Hello guys, please join the quiz using the QR code here, or you can join the quiz using the link given in the Telegram group. We'll start the quiz as usual. We'll start it at 10:10. 5 more minutes to go. So let's wait for your friends to join. So next 3 more minutes, we'll start the quiz. So those who are watching us on YouTube Live, you guys can join the quiz using the link given below in the comment section. And later you can always come back and see the video for any explanation or any clue if you want to revise the topic. Okay, it's 10:10. We'll start the quiz. So, hello guys, welcome back to another exciting session of Juxtamed quiz. So, today we'll be having quiz on hematology, which includes RBC, WBC, and platelet disorders. So, let's start with the first question. Yeah, chronic alcoholic presents with fatigue and glossitis. Peripheral smear reveals hypersegmented neutrophil and macroovalocytes. Homocysteine levels are elevated, but methylmalonic levels are normal. Which of the following best explains the neurological status in this patient? So think about which vitamin deficiency does not affect the dorsal column here. So let's see. Yeah, the right answer was no neurological symptoms. Can you tell me the diagnosis for this question? So the diagnosis is folic acid deficiency. So in folic acid deficiency, we do not have any neurological symptoms seen. The demyelination of the dorsal column are mainly seen in vitamin B12 deficiency. And also the first sensation to be lost is vibration and proprioception. Okay, let's move, see the leaderboard. Okay, we have PS leading and followed by Naga in the second place and Akib in the third place. Okay, guys, let's move on to the next question. Just a minute, guys. Okay, yeah. Okay, moving on to the next question. A 50-year-old chronic alcoholic presents with fatigue and pallor. CBC shows HP of 8.2, MCV of 95, and a reticulocyte count is 0.8%. Serum iron and ferritin are elevated, while TIBC is decreased. So bone marrow shows ringed sideroblast. What is the defect seen here? So it's a disorder of heme synthesis that involves mitochondrial iron trapping. Yeah, the right answer was vitamin B6 deficiency. Okay, we have RDT in the first place, followed by PS in the second place, R in the third, then Urvashi, Shanmuga Priyan, Kirtana, Naga, Ashish, Itachi, Aisha, Akib, AG. Okay, guys, good going. Let's move on to the third one. A 28-year-old old woman presents with history of easy bruising, recurrent nosebleed, and prolonged bleeding after dental extraction. Her menstrual cycles are heavy and prolonged. She has increase in APTT, increase in bleeding time, and normal platelet count. Which of the following best explains the coagulation abnormality in this patient? So we need to see three things here. That is increased APTT, increased bleeding time, but normal platelet count. I think you can narrow down to two options here easily by seeing these three values. Yeah, the right answer is von Willebrand factor. In factor VIII deficiency, as you know, we'll get the bleeding time is normal in factor VIII deficiency. Okay, we have RDT in the first place, Urvashi in the second place, and Shanmuga Priyan in the third place. So fourth place we have Akib, fifth place Naga. Okay, guys, let's move on to the fourth one. Which of the following is the most characteristic finding in the bone marrow of a patient of immune thrombocytopenic purpura? Yes, I guess you guys will get it easily. Yeah, the right answer is increased megakaryocytes. Because as immune system is destroying the platelets, naturally the body's response or the bone marrow response is to increase the blast cells, which is megakaryocytes. Okay, we have Shanmuga Priyan, who is leading now, followed by Akib and RDT. And also Shanmuga Priyan has the longest streak. Okay, so let's move on to the next one, fifth question. A 16-year-old male with known sickle cell disease presents with sudden onset of pallor, fatigue, and dyspnea. His hemoglobin drops from 9.5 to 4.8 gram per deciliter over 2 days, and reticulocyte count is 0.2%. There is no jaundice, normal bilirubin, and there is no changes in LDH. What is the most likely diagnosis here? So, which virus can temporarily shut down erythropoiesis? Yeah, the right answer is aplastic crisis. Okay, we have R now, who is leading, and we have Shanmugapriyan in the second place and Akib in the third place, followed by RDT, Hemant, Amygdala, Soumya, Urvashi, PS, and Itachi. Okay, guys, good going. 5-year-old boy presents with pallor, petechiae, and recurrent infection. Peripheral smear shows blast cells. Flow cytometry reveals the presence of CD10, CD19, and TDT positive cells. But the cell here lacks CD33 and CD34 expression. What is the most likely diagnosis? I guess if you are good in CD markers, then you will easily get this answer. Yeah, yeah, the right answer is BALL. I think for TALL, I think we need to have CD3 marker if I am not wrong. Okay, let's see the leaderboard now. Okay, we have R in the first place, followed by Shanmuga Priyan and RDT in the third place. We also have Amygdala, Akib, Itachi, then Naga, Hemant, Singham, okay, Soumya. Okay, guys, good going. And we also have Amygdala Gallant saying the right answer. Yeah, you're right. Salmonella. Okay, let's move on to the seventh question. 12-year-old boy from Africa presents with rapidly growing jaw mass. A biopsy of the lesion shows a starry sky appearance on histology. So, immunohistochemistry reveals tumor cell expressing CD10, CD19, CD20, and BCL6, but negative for BCL2. What is the genetic abnormality which is found here in this condition? Yeah, the right answer is involving the CMYC and IGH. Okay, we have Shanmuga Priyan back in the first place. Then we have RDT in the second place, and we have Amygdala in the third place. Okay, moving on to the eighth question. All rods are most commonly seen in which of the following leukemias? I think this is the easiest question of today's quiz. Also, there's no clue required for this question. Yeah, the right answer is AML. Let's see the leaderboard. Okay, we have RDT leading in the quiz now, followed by Shanmuga Priyan at second place and Amygdala in the third place. Okay, guys, we have R, Itachi, Urvashi, Myra, PS, Soumya, and Anusha. Okay, good going, guys. And we also have Amygdala giving us the right answer in YouTube comment section. Okay, moving on to the last second question. A 65-year-old male with bone pain, anemia, and renal dysfunction is diagnosed with multiple myeloma. Urine protein electrophoresis shows Benz-Jones protein. What is the most common cause of renal failure in this condition? So here we know the diagnosis, but they are asking us on the complication of it. So to give a clue, it involves light chains forming some obstructive pathology. Yeah, the right answer is light chain, which causes renal that is nephropathy. Okay, we have amygdala leading now, then followed by R, RDT, Chanmuga, Priyan, Moira, Anusha, Itachi, Aisha, Komal, Urvashi, PS, Soumya, S, Reddy, Ram, Ashish, Akib, Kirtana. Okay, it's good going, guys. Okay, last question of the quiz. Old male presents with fatigue, weight loss, and splenomegaly. His CBC shows leukocytosis with a left shift. Peripheral smear reveals increased myelocytes, metamyelocytes, and basophil. Which of the following confirms the diagnosis of CML? So here, look for a famous translocation involving chromosome 9 and 12. Can you guys type what is it called? What is the name given for the chromosome here? Okay, we have Amygdala as the final winner of today's quiz. So congratulations, Amygdala. And we also have R, who is the second winner of the quiz, and RDT as a third winner of the quiz. So congratulations, guys. And we have Tanya giving us the right answer, that is Philadelphia chromosome, which is more commonly seen in CML. Yeah, you guys are right. Amygdala, Akib, Komal, Asadi, you're all right. So congratulations, guys. So today we have finally completed hematology. So we are done with general path. We are done with hematology. And I think from tomorrow we'll be heading to systemic patho. And I guess tomorrow's topics are, I think, CVS, GIT, and renal. So a few more systemic topics to be completed, and we'll be done with pathology as well. So good going, guys. Please keep reading, keep revising, and attempt as many questions as possible. So we'll definitely get to the dream rank. So thank you again for joining the quiz today, and see you in the next quiz. Good night, guys.